Good afternoon, everyone. You are very welcome to the Promotion and Supporting Mental Health Updates and New Initiatives. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using any other digital device, you may find this feature located by the three dots. Now, without further ado, I'm going to hand you over to your hosts for today, Aisling Sheehan and Derek Chambers. Thank you.
Good afternoon, everybody. You're really welcome to today's webinar. And this webinar is being held for World Mental Health Day, and you're all really, really welcome. My name is Aisling Sheehan, and I'm joined by my co-host, Derek Chambers. And if you bear with me now, I'm just going to share some slides. Now, this is a brief overview of the webinar today. So myself and Derek together will be providing you with some updates on new initiatives all around promoting and supporting positive mental health for our population. Then we're going to do a deeper dive into 3 of these initiatives: the Navigator tool, the online balancing stress program, and social prescribing. And then we'll finish with a panel discussion. We are recording today's webinar and we'll be sharing the recording with everybody after today, and we really welcome your questions. We'll do our best to answer as many as we can in the chat. Firstly, Derek and I just want to begin with some policy context for this work. So all of the initiatives that we're sharing with you today deliver on the implementation of a number of actions within all of these policy documents. And all of these policies have a really strong commitment to the importance of promoting positive mental health, and that is essential for our overall health and well-being in the population. Starting with some of the more recent policy documents. So we most recently had the implementation plan for our mental health policy, Sharing the Vision. And there's some really strong commitment here and a number of actions around promotion, prevention, and early intervention. An action within Sharing the Vision was the development of a national cross-governmental mental health promotion plan. And we're really pleased to have seen that launched in December of last year, Pathways to Wellbeing. The HSE also has its own mental health promotion plan, Stronger Together, and this is very aligned to Pathways to Wellbeing. And we also see in Connecting for Life our suicide reduction policy, which is being updated again this year. Again, a really strong commitment to promoting positive mental health. So we really wanted to take this opportunity to mark World Mental Health Day to just share some of the updates, some of the new initiatives that we've been working on to realise the actions across these policy documents that are all around promoting and supporting positive mental health. I'm going to hand you over now to Derek, who's going to provide you with the first of those updates.
Thanks very much, Aisling, and great to talk to everyone this afternoon. So just briefly, and Aisling has given us the context, I'm going to give you an overview of some key initiatives that we're developing. And I suppose importantly, the initiatives that I'm going to highlight at the outset are for everyone. They're for the whole population. And they're built around making it easier and making support more accessible. So we know it can be difficult to reach out for help and support, whether it's for yourself or someone you care about. And one of our priorities together right across the HSE is to ensure that we make it as easy as possible. So the first initiative to highlight is My Mental Health Plan. So this is a resource that's available on the HSE website through yourmentalhealth.ie. And My Mental Health Plan is built around the objective of increasing mental health literacy for the population. So we know from how people search for help that some of the key issues that people are concerned about are anxiety, stress, low mood, and sleep difficulties. So along with carrying content on those issues, this resource has been designed to make it interactive and engaging, to get more personalized support to help you with those particular issues. It's really basic, it's really straightforward. There are 4 questions that ask you about those key issues, and based on the results that you input, it provides you with tailored support. So that's something, if you have your phone on you now, if you want to just even look it up through the HSE website, if you Google My Mental Health Plan HSE, it'll pop up straight away. Since it launched in January 2024, we've had over 20,000 people complete it. And almost everybody who starts the resource, starts My Mental Health Plan, completes it. It's that easy to use. So well over 90% of people complete the quiz once they start it. So based on a similar concept in terms of sharing a little bit about what's going on for you, sharing a little bit of information on yourself and how you're feeling, Navigator was launched back just in June. So Navigator, similar concept, but designed for a different audience, designed for younger people, and developed by our partners in Spun Out. So Spun Out are a key partner organization for us and have been providing really engaging and quality health information and mental health information in particular for young people for years now, for almost 20 years. So Navigator, similar concept, but does delve into a much wider range of issues, and allows young people, I suppose, to as per the name, navigate the support system that's out there, but also provide direct access to supports. So one thing, for example, you can do through Navigator is access the text about it service. There's an option on Navigator which allows you to engage with somebody there and then via text or WhatsApp. We're going to go into Navigator in a little bit more detail later on with our colleague Sophie May Harrington. So I won't say any more about Navigator at this stage. We'll highlight it further. But we do want to mention some other key supports that have been promoted recently for men. So men's mental health is a key concern for us at the moment, and in some ways that concern is built around the suicide rate amongst men, and the ratio of, I suppose, male to female suicide in Ireland is, even by international standards, it's really high. And Minister Butler has made men's mental health a priority for that reason, and I suppose because of the traditional reluctance to seek support or seek help amongst men. So just in recent weeks, in the middle of September, an initiative was announced whereby supports are being scaled up through Connect Counselling, through My Mind, and through the promotion of all of the free to access and available supports that men can access. And a lot of that is being promoted through GPs, and I'm really conscious that our messaging for a long time has been, if you're concerned about your mental health, speak to your GP. And from our perspective, that creates an onus on us to make sure that GPs have a range of options that they can signpost people to if they are sitting across from somebody that they're a bit concerned about, whether that might be to do with anxiety or depression or stress. It's really important that GPs have those options. So free to access counselling through My Mind, again, a great partner organisation, and confidential telephone support through Connect Counselling are just two of the initiatives being promoted through that new service for men. And then a final thing to highlight just at the outset is the Let's Talk About Suicide programme, which is publicly available to anyone in the population to access. And this programme was developed by our colleagues in the HSE National Office for Suicide Prevention. It's a fantastic and really accessible resource for a topic that's so difficult to talk about. And if you haven't had the opportunity to maybe avail of some training or to speak to somebody who can guide you through what is really, can be a difficult topic, this is a fantastic initial way to access information on suicide, so that you learn to recognize the signs that somebody might be struggling. You also gain confidence in knowing how to maybe broach the subject with somebody and to direct them towards supports and services. So again, we would really encourage people to access that through the HSE website, and the links are there, or through the training hub on the National Office for Suicide Prevention website. So there are just a few initiatives highlighted, and we'll delve a little bit deeper into some other initiatives shortly. But before we do that, we're going to take a deeper dive into the Navigator resource and have a conversation with Sophie May Harrington, who will introduce shortly. But we'll show, I think, a short video on Navigator now. So if we can see the Navigator video, that would be great.
Searching for mental health support online is exhausting. With endless options out there, you can end up lost in 50 different results with no clue where to start. It's overwhelming, it's confusing, and honestly, it shouldn't be this hard. That's why Spun Out made Navigator, a free tool that connects you to information and support in seconds, no guesswork needed. Just 3 simple questions and you get trusted resources that are fact-checked by experts and hand-selected for you. For any of your mental health concerns, whether you're feeling anxious, lonely, or uncertain, Navigator helps you take the next step. With expert information, local support services, and resources to help you move forward feeling better. Navigator cuts through the clutter and does the hard work for you. It's free, anonymous, no sign-up required, and it's made specifically for people in Ireland. Anytime, anywhere, and whatever's on your mind. Navigator is here to help. Give it a try now. This service is funded by the HSE.
So to talk about Navigator, I'd like to welcome Sophie May Harrington. So Sophie May is an assistant psychologist with Studio 3 in Kerry, but also has been a member of Spun Out's Youth Advisory Panel for a number of years, and has also lived experience of mental health difficulties and using our mental health services. And I've had the pleasure of engaging with Sophie May over the last few months, including around the launch of Navigator. So you're really welcome, Sophie May. So for me, I'm conscious that we were part of the steering group that was developing or supporting Spun Out in the development of Navigator. We were very, very aware that separately or side by side, there was a group of young people, a national advisory panel, who was also probably in more detail supporting the development of Navigator, and the insights that you brought to that and the experience that you had. Could you describe a little bit about that, please, and maybe just tell us what that was like for you and you guys as a group?
Yeah, absolutely. So I was involved kind of from conception before Navigator was even formulated, or we knew what it would look like, or even fully what it would do. But I was by no means the only young person involved. So we did have a Navigator Advisory Committee, which was 15 young people recruited both from Spun Out and from Jigsaw, and they had lived experience of seeking mental health help or using mental health supports. And we wanted to make sure that we represented a diverse a range of diverse backgrounds. So we had people specifically from the BAME panel, which is Black, Asian and ethnic minorities in Spun Out. We had people from rural Ireland, and we had people with neurodivergence or gender identity differences, just to make sure that everybody was represented. And then even beyond Spun Out, we also, it's just so important to get the views of your intended user group or your audience. So we also had online surveys and things just to the public in Ireland, and we had 898 respondents weigh in on their opinions and their feedback on what they'd want this tool to look like, or what they'd want it to do. And specifically on the features. So it was found that people were very against making an account for having to use the tool, that anonymity and privacy was very important to people. So that is something we incorporated. Also, the number of results shown, people wanted a smaller number of results to be shown rather than being given a whole host of things that they then have to sift through. And also just what they found were the most important topics to them to cover in the tool when navigating mental health supports. And then I guess going back to the actual advisory committee. So over the course of a year and a half, we had regular meetings where we would give feedback or consult on different aspects of Navigator, from the design to the content to just essentially every aspect of Navigator. And when we weren't in meetings, there was continuous and ongoing feedback through Slack and through kind of online surveys and things. And then of course, there was what the most important thing really was the iterative feedback. So I guess you could speak more to the construction of the steering committee that side of things. But then the feedback that was between the two groups is that everything that was said in our meetings was passed back to the steering group, and then everything in the steering group was passed back to the Navigator Advisory Committee. So then we could see how our feedback was implemented, but then also give feedback on the steering group's feedback and whether or not we agreed with it.
Yeah, and that is the experience that we had on the other side of the table. We, down to talking about color palettes and appealing to different parts of the population. We might have a view, and we were told, sometimes we were told, no, that's not the feedback we're getting from the key target audience. So, that was a really robust experience. And I think we see a fantastic result and a fantastic output from it. So I know it's something that I think will go from strength to strength. I was just looking at some of the numbers this morning. I think I worked out that it's over 7,000 sessions per month, averaging since it launched, which is only in the middle of June. But I think those numbers are hugely significant. And sometimes we talk about these numbers and we don't reflect on them, but that's a big volume of signposting and a big volume of service provision. And similarly with Text About It, I know that they're averaging close to 4,500 conversations per month. Again, that's a lot of support being provided. Can I ask you a little bit, maybe outside of Navigator or building on from Navigator? I know you're working in the mental health services now. What's that experience been like? And just thinking to the future, what do you think we should be thinking about by way of service improvement, accessibility, what we're doing to support young people? Are there things that are coming up for you?
Absolutely, yeah. So I recently transitioned into, I guess, the same role, another assistant psychologist role, but in a new context. So working with Studio 3, it's really interesting because it's almost like there are bespoke services that are built up around the service user. And it's been really great to see the service user being put at the center, and that we're really lucky to be in a position where we can create services specifically for the person and for what their needs are. And so that's really had me thinking about kind of the future of mental health services and what I will bring to the table going forward. A lot of the voluntary work I do and things that I'm involved in are related to CAMS services and AM services, and even more specifically kind of that transition between the two services. So even what I've seen in this role is that a lot of services do great work, but they're not aware of each other or kind of how they could work together and integrate each other's services for the benefit of the users. And so something like Navigator, the aim is to not only direct people to relevant supports and to help them find credible and reliable information, but also to raise awareness of the available services from the service user standpoint, but also from the services themselves. They're going on to see if their services are on the website and what they're being listed for, and then seeing other services that are also listed for that and saying, oh, interesting, I never knew they were a service. And so what I'd love to see is more integration across the board. And I think even like creating Navigator was a great example of the HSE coming together with Spun Out, which is a great facilitator for youth involvement, to then engage the public. And so you had such a broad range of people giving input. And I think that's why we've been able to create something that I think is really great.
Yeah. And it's the world we live in, people can sometimes be territorial, but I think we see with the way that we're working as a sector nowadays that there is genuine integration and partnership, and Navigator is just a really good example of that. It's about providing not just information on the full range of supports and services that are out there, but potentially as time goes on in subsequent phases of development, providing direct access to some of those other services, which I know is something that we have a vision around. So we need to really, we talk about integration a lot, but I think the more practical examples of integration that we can achieve, the better. So for me, thanks so much. I know we're going to come back to a wider panel discussion in a little while, but at this stage, I think we wanted to switch direction and talk about another program that Aisling is going to introduce, I think. So for me, thanks so much for now. And as I said, we will be coming back to you before for the panel discussion. Thank you.
Yeah, no problem.
Aisling, can I hand back to you for to introduce Niamh?
Yes.
Yeah.
Yes, thank you so much. I'm just going to share a few more slides. Thanks so much to Derek and to Sophie May. Really great to get a bit more in-depth look at the Navigator tool. And I'm now going to share some slides with you just to provide a few more updates on some other initiatives that we've been working on at HSC Health and Wellbeing and in partnership with others.
Aisling, just we're not seeing your slides, so do you require me to share them for you if you've already started to share?
Yes, it's just frozen for me, Jean. So yes,
That
that'd
is
be great.
perfectly fine. Just give me a minute. And
Thank you.
Derek, we can still see yourself. Unfortunately, we can't see you, Aisling. So if you just bear with me,
Okay.
I'll pull up your
If you can
slides.
hear me, that is great.
We can hear you. You just need to tell me which slide to start on. So I don't think it.
Perfect. So we'll start with the balancing stress slide, Jean.
Oh,
And
there we go. Thank you. I will remain quiet now.
perfect. Thanks so much, everybody. Apologies for this. So I just want to just very quickly give you an overview of some additional initiatives that we're working on. So the Balancing Stress program, some of you may be familiar with it. We launched it earlier this year, and it's an online program to manage mental health difficulties, including stress, anxiety, low mood, relationship difficulties, and worry. And I'm delighted to be joined by Dr. Niamh Clarke shortly, who's going to tell us a little bit more about the development of the programme and who it's for. But it's a really accessible, free programme that's available online on the HSC website. You can find it on yourmentalhealth.ie. There's 6 sessions, and each video is around 35 minutes long. And we're really pleased with the engagement with the programme to date. We've had, since it launched in May, we've had over 19,000 online users. And it has, we've really seen growth in engagement as we've been promoting the programme. We've been disseminating posters widely, and that's really making an impact. We can see through our QR codes and tracking that's really helping drive engagement. And also through our social media promotion as well. So I won't say too much more because Niamh will be giving us a little bit more detail on that shortly. The other initiative we want to spotlight as well today is social prescribing. And social prescribing is a free service that connects people to a range of community activities and supports with the aim of improving health and wellbeing. And we have HSC funded social prescribing services all across the country, in every county and in Ireland. Really delighted to be joined later by Ethna Foley, who's the social prescribing link worker, who's going to tell us a little bit more about the service. We've had, in the first 6 months of this year, almost 3,000 new service users availing of the service. And I think some really powerful quotes that hopefully you'll be able to see is just around some of the feedback we're getting from service users through our research and evaluation, just showcasing the power of it in terms of supporting and promoting positive mental health and belonging and meaning within people's lives. The third initiative and the final one I just wanted to briefly mention is our Minding Your Wellbeing programme. So our Minding Your Wellbeing programme has been running for a number of years, delivered by Health Promotion Improvement staff in HSC with HSC staff. And it's a positive psychology programme all around developing a positive outlook to looking after mental health and wellbeing. It covers mindfulness, gratitude, self-care and resilience. And we have been fortunate to look at now adapting the programme for community settings. We did an adaptation with older people, which was really successful, and we're now partnering with Age Friendly Ireland and other community partners to roll that out in the community. And we're also looking at an adapted version targeting specifically men. It's also available online, free to use for anybody who's interested. Each video, each of the 5 videos is about 20 minutes long. So we'd really encourage you to have a look at those if you haven't seen those and to support us with their dissemination. So we're now going to do a more of a spotlight on balancing stress, and I'm going to invite Jean now to share a short video with you to showcase it.
Feeling overwhelmed? It's time to take action. Balancing Stress is a free online program created by the HSC to help you manage your stress. To find out more, go to the HSC Balancing Stress program.
Hi. I hope you can all hear me and see me. It's Niamh Clarke here from the Balancing Stress program, and I'm absolutely delighted to be with my colleagues today to promote World Mental Health Day. You've heard a little bit about balancing stress, and I'm going to spend the next 8 to 10 minutes just kind of zooming in and hopefully making it a very easily and navigable program for everybody concerned. So I'm hoping that my slides are going forward, but they have stopped for the moment, so we won't panic. There we go. So as my colleague Sophie May said, with every program, there's a lot of people behind the scenes. So there was a content team which was made up of our health and wellbeing colleagues, psychology colleagues, and academic colleagues, and many of you might recognize some of the names there. We needed a design team, and we couldn't have done this without Spark and our wonderful colleagues in NCAD, and our video production team. And like Sophie May was saying, she had, user testing. This was user tested widely in order to make sure that we were fit for purpose and we were doing what was required. The communication team has been instrumental and have done Trojan work, I suppose, in promoting the HSE Balancing Stress program. What is it? As Aisling has said, it is a partnership between health and wellbeing and HSE psychology. It's a universal program, which means it's of benefit to the general public, for everyone from the ages of 18 upwards. It helps to recognize signs of stress and to equip participants with tools to manage stress in very healthy ways. It's 6 by 35 minutes, similar to what Sophie May was saying. When we went out to our panels, they said, make it short, make it snappy, make it easy to navigate. And we took that advice, and that's why it's 6 35-minute sessions. Just a little few facts about stress. We're ranked 6th in Europe at the moment, which isn't a very good place to be. It is a very common problem, with 64% of people in Ireland saying they feel stressed once a week. Interestingly, stress is more prevalent in women and younger people under the age of 30, and it impacts on sleep significantly, with 6 out of 10 adults saying they're having difficulties. The most common stressors won't come as a surprise to anybody. Financial concerns are cited with 78% of Irish people. Family life is a significant stressor, particularly for women and those between ages of 35 and 54. Health issues, and again, no surprise, 55 plus. Seasonal stress, which we may not have given as much thought to, with 56% of people saying they're more stressed with the lead up to Christmas. Workplace stress, unfortunately, has doubled in the last decade, and you can see the stats rising there for that one. So as I said, this program is for everyone and anyone, because we all experience stress. Now, stress isn't all bad, as we've said before. It's a natural, helpful response that prompts us into action. And otherwise, we may not, get activated for things that are of benefit to us. However, what we do know is too much stress negatively impacts. The program itself is based around 2 psychological models, and that is CBT, which people are very, very familiar with, and positive psychology, which Aisling referenced in the health and wellbeing program earlier. So what is stress? And as I've said to you before, I've kind of tipped on this already. It is when we're faced with challenges, too many challenges that we're able to cope with. So stress is always going to be part of our lives. There's no getting away from it. And it is that mental and emotional strain that we experience when something difficult or challenging emerges. So it is really important to learn ways to cope with this so it doesn't take over our lives, because there's no getting away from it. So what causes us stress are called stressors, and everybody's stressors are different. Mine are different to yours. This morning, I know it sounds very trivial, but I couldn't get my contact lenses in. Now, that did cause me a huge amount of stress, because I thought, oh, there'll be a lovely glare now with my lovely glasses. But anyway, here you go. Obvious stressors are relationship problems, finance problems, work and illness, and even positive things like moving house, starting in college, new relationships, a new hobby, socializing. All of that can also cause us stress. So Our body is the brilliant detector, as we call it, and it is often where the first signs of stress are felt. They're in our body. They're felt as physical sensations. And for some people, they're very familiar with that muscle tightness, that sweating, that heart pounding, headaches, dry mouth, fatigue. Some people get all of those physical symptoms and others get one or two or a combination. Emotional symptoms are also very evident. Sometimes we talk about feeling anxious or sad or irritable or angry. And then our cognitive symptoms. So we become very critical of ourselves and of others. And worry and anxious thoughts can take over. So a very difficult space to be. And then our behavioral symptoms, where stress can impact the way we behave. We can become easily annoyed. We can lash out at people, which we typically wouldn't lash out at. And for others, they can retreat. They can become quieter and start avoiding people and places. Our sleep is impacted. We can eat more or less, or drink more or less. So you can see the array of symptoms there of stress. And for some unfortunateness for people, they may feel all of those things. So you can see how clearly that is going to be a very difficult place. So then for the impact on stress. So as I've said, you've got the symptoms, and now how is it impacted? As I said, on mental health, we get low mood, depression, irritability. Physical health, which is sometimes not spoken as much about, our energy levels drop, our immune system can be impacted negatively, and sleep is disrupted. And then our relationships with our cornerstone of I suppose, supporting a healthy person and healthy well-being. How we communicate is impacted, our intimacy levels are impacted, and then we have an increase in negative interactions, which is absolutely what we don't need when we're stressed. Our work, whether that's working from home or working in a different setting, our productivity is impacted, and the quality of our work, our motivation levels to do things, and even our energy levels to do things, our decision making. And some people, say, I just couldn't make a decision. I wasn't able to make a decision. When things become overwhelming, it then does increase on our creativity, and it increases on our absenteeism levels, whether that be at home, absent in body and mind from the home, or in a working setting. Ultimately, then, our overall well-being is impacted. So getting on to the core content of the program. As Aisling said, there are 6 sessions. Each session takes a different topic. You can see that. The first one is understanding stress. The next one, managing worry, then anxiety, low mood, stress and relationships, and balancing stress into the future. Each session is structured exactly the same. So in order that people feel comfortable with the format, each one begins with a relaxation session. It goes into theory. Then you meet a case study. The one on the screen is Anne and Dara. Practical evidence, practical strategies, evidence-based. Then we go into guided meditation, and we have an interview with Professor Alan Clarke from UCD, and you'll see a clip of Alan at the very end of this. Each session then has practical tools and strategy. I'm just giving you a quick whistle-stop tour here, and this one is in session 2. When we look at challenging negative thinking in understanding worry. So because when we worry, our thinking can become impacted. So this exercise helps you to examine this differently. Is there other ways I can think about this? And what would my best friend say to me? So you're given very practical examples in each of the sessions. Another example, and I'll give 3 in total, is facing your fears in session 3, confronting the things we're anxious about and what we have control over. Sometimes referred to as exposure therapy, because we know that if we avoid what's causing us stress in the short term, it brings relief, but in the long term makes the problem more difficult, and you're talk through an example on the session. And final, I suppose, example is behavioral activation, which is used in session 4 when we look at understanding low mood and depression. Because we know when we're feeling low, we tend to become less active. We have increased negative thoughts. We spend more time alone, and our interactions with others can become strained and difficult. So what is behavioral activation? It is planning pleasant activities. And we know from the evidence that if you don't plan them, they often get pushed to one side, and this perpetuates the cycle of low mood and depression. Using the Balance and Stress program in practice, I suppose what we also focus on is the positive psychology piece, which is making time for others. These things sound very small, but they actually make a massive difference. Small things do matter. Connecting with others, kindness, social prescribing, volunteering, gratitude, looking at your character strengths, and positive affirmations. we ask in the final session, in the first session, we look at character strengths. We kind of describe these as being, an armor. All of us have strengths, and we tend to not look at strengths but weaknesses. And this allows us then to guide people through looking at their positive character strengths. So you more or less, most of us have between 5 and 7 of these, and using these in everyday life in order to armor us from the impact of stress on our lives. And then we have, partner packs, which basically we will share with you, which will allow you to use this program, because we want this to be as useful to you as it could possibly be. Take any of the materials we have to share and you can learn from. And there's a few testimonials, and I'm going to hand you back now to Ashley.
Over the last couple of decades, there has been a rise in stress.
Want to learn more about managing stress? Join me, Dr. Niamh Clarke, and Professor Alan Carr, where we share expert tips to help you balance your stress. Go to the HSC Balancing Stress Programme.
Derek, we seem to have just lost Aisling again. Would it be possible for you to come back on, please?
Sure. Thanks, Jean.
Thank you, Derek. I will add you to the screen there now. And you're on with, oh, Aisling's back. So the two of you can stay on if you'd like. I'll let it up to you.
Thanks so much, and apologies for my technical difficulties. I'd love to introduce you now to Etna Foley. And Etna is a social prescribing link worker, and she works at Lakela Family Resource Centre in Mallow in Cork. And it's really great, Etna, to have the opportunity to chat to you about social prescribing, which is one of the initiatives we highlighted earlier. And just from your perspective, Etna, for those people who may be not that familiar with social prescribing, can you tell us a little bit about how it works and what it entails?
Sure. Thanks, Aisling, and thanks for having me here. So social prescribing is a free service that a person can avail of, where they sit down with a social prescribing link worker, chat about how things are in their lives and any positive changes they wanted to make. And then the social prescriber will help to link them in with whatever community resources would benefit them. So that could be anything from the social group, it could be volunteering, it could be back to education, it could be linking the person to the welfare services. It's really a question of what's useful for the person, what they want to get out of the service.
Yes, brilliant. And what kinds of clients or service users do you think can particularly benefit from social prescribing?
Yeah. I think the main thing is the person themselves has got to be in a place where they want to make the change themselves. So if a family member or a health professional wishes the person would get out more or whatever, the person has got to be in a place of making that change themselves. And we get people from, it's over 18 service, my service, so really honestly from 19 to people in their 90s in all kinds of situations. It could be somebody who's feeling a bit isolated. It could be somebody who's had a change in their lives. Maybe they're retiring or they recently moved into the area or they were caring for somebody who's passed away. It could be somebody who's coming out of addiction or domestic violence services who needs some kind of support to get back into community activities. So it's a massive range of people. And really the thing they have in common when it goes really well is that they have that willingness to change themselves, that they're ready and able to make a change themselves.
Brilliant, Etna. That's a huge diversity of needs that you're working with. How do you tailor the service then to meet that huge variety of needs that are there?
Yeah, well, it's a great part of the job because it's such a diverse group that you're working with. It's never, every day is different. Every client is different, really. So I suppose what we would do as social prescribers is really always have in our mind, it's what matters to the person. So the person is there, it's what's important to you, what changes do you want to make, how can this service be useful to you, and then we go from there. So the social prescriber would know lots about what's going on in the local area. I'm in a family resource centre myself, so that's great, there'll be things in the family resource centre, but we'd know what's going on in the local further education, colleges. We know what's going on in the libraries, the different community groups, the social groups, the crochet groups, etc. So we'd have like a database of some kind of what's going on. And then when the individual person is there, it's a matter of giving them the information that's really tailored to them, that's important to them.
Mm-hmm, mm-hmm. Brilliant. one of the things that we get a question a lot about is just as a healthcare professional, a person working within a community voluntary organisation, how do I know it's an appropriate referral to refer to social prescribing? And I know in your own service, Ethna, you had done a lot of work yourselves in your service to look at that and develop some guidelines and a standardised referral form. So we've been really fortunate to learn from that work, Ethna. And very much based on the work that you did in North Cork and also in other parts of the country, we have now developed a standardised referral form for social prescribing and an information guidance for referrers as well. So I might just ask that we just pull up just a visual of that just so that people can see it, and would be great, Ethna, if you could just briefly talk us through what people can expect to see in that, and maybe just a little bit about the process of developing that.
Yeah. So some people make contact with the service directly. They would ring the social prescriber. They might ring me, having seen me on social media or something, or they might ring the Family Resource Centre in my case. But then the majority come from external referrals. So it could be from GPs, public health nurses, OTs, the community voluntary sector, etc. So they would generally then fill out the referral form with the person's permission and consent, and send it to us. And then when we get that, we'd ring the person, explain what the service is, answer any questions, and see if the person wants to go ahead and make an appointment. And people generally do, but sometimes people will say, oh, I'm a bit too busy at the moment, can you call me back in the new year? Or maybe if someone's been just discharged from hospital, they're only getting their feet on the ground or what have you. So in general, we'd make an appointment straight away and see them. And then if not, then we would wait and they could come back to us, or we'd go back to them, depending. So the new referral form is great. It's very clear, and the more it comes in stream, it's great.
Great. Thanks so much. We can pull that down now. It was just to show people, and we'll be sharing all of these resources after the event as well, and pulling them all together in one place for you. Just back to Ethna, what you were saying earlier, just around that diversity of needs. We know from some of the data that we collect that social isolation and loneliness are some big issues that people may be experiencing. Can you give us a flavour of maybe some of the other needs that you see, or some of the common things that you would see on a day-to-day basis?
Sure. I would say the desire for more social connection in the broadest sense of the word is for sure the biggest thing, certainly that I would see, that most of us here would see. That is the very, very biggest thing. Other things that would come up would be addiction supports, maybe some, again, as I mentioned, somebody coming out of addiction supports. It could be somebody wanting to get back into education, not quite knowing where to begin, and wanting to volunteer, wanting counselling. So it could be also sometimes people just want to get back into better habits themselves. Getting up earlier in the morning, getting back to walking with their sister-in-law. Do you know what I mean? Just those very simple things. Sometimes it's those kind of things that we end up talking about as well. But I would say the desire for social connection is the very most common thing that we see.
Okay. And what changes have you seen, Ethna, in your experience of working with people over time?
Well, I started in 2020, so COVID just struck. So I suppose after that, there was a lot of post-COVID things we were coming across, people who'd gotten into the habit of staying in, maybe groups who closed down and went online. They didn't all come back. But that, luckily, things are balancing out now and back to an equilibrium. But that was an issue for a while, that kind of post-COVID period. I suppose another change you've seen is there's just so much more awareness of it now. There's just so much more awareness of the service. So referrals are coming in from far and wide. When we were getting the service off the ground at the start, we were trying to let health professionals know about it, but there's much better awareness of it now.
Great. And the impact that you see on service users, Ethna, we shared a couple of quotes earlier that's emerging from some of our research that we're doing, and I think some really powerful evidence emerging from that, just the changes that people themselves feel in their connectedness with their community, their mental health and well-being. What do you think? What do you see as the impact for people that you work with, Ethna?
Yeah. You see huge change in many people, and you see people, you might even be passing a local cafe in your local town and you see somebody chatting with a friend, you think, oh my gosh, I worked with them previously. I think joining groups is just the very, very best way of getting to know people and making new friends. And I mean, all the research says that the more connected we are to other people, the happier and the healthier we all are. It's great to see people starting in courses, starting to volunteer. People also would come and see us and then maybe might come again in 8 months' time or 14 months' time and be in a very different place. So it's always great to see that. So yeah, see really positive changes for people.
And sometimes people just need that little bit of support to kind of enable them to enter into those spaces that maybe before might have been a bit intimidating, or people might
This is
not have
because
confidence.
there's people who will just be in the local supermarket and they'll see a sign for chair yoga and they just ring up the number and they just go. And that's absolutely fantastic, and they don't need to come through social prescribing at all. But a lot of people just want to talk things through first. They're nervous of getting back into groups, or they're nervous that everybody in the groups knows each other already and they'll be the one on the outside, you know, or they might be wanting to say something specific like, I only want to go to like a smaller, quieter group, not a very big, noisy group. And so it's that kind of bespoke information then that the social prescriber would have.
Yeah, so that's your role then, Ethel, in supporting and enabling people to connect with their communities and support their own health and
That's
wellbeing.
right, yeah.
Fantastic. What would you like to see into the future, Etna, for social prescribing? You know, it's our own ambition within the Mental Health and Wellbeing Programme to expand and to have a service available in every community healthcare network across the country. What would be your hope?
I mean, you kind of took the words out of my mouth, in that if I was writing to Santa Claus, that's exactly what I would hope for. Because even within County Cork, loads of areas are covered, and that's fantastic. And the social prescribers are linked in with each other. We share pool resources, that kind of thing. But then some areas are totally uncovered. So I wish there was a social prescriber for every person in the population in the country that they could access. And it's really hard if somebody contacts you and they say, is there a social prescriber in the area? I'm working with someone, and to have to say, I'm really sorry, there is no social prescriber in that area. So I would absolutely love to see more rollout of roles. It would just be fantastic.
Absolutely. And we are slowly increasing, incrementally increasing the number of coverage. We have 4 new sites coming on board this year with the Care Health Communities. There's 4 new sites for that. And we do have the All Ireland Social Prescribing Network, and we've shared the link to that, has a map so people can see, you know, where the services in their areas and get more information on their local social prescribing services. But yes, something to work towards into the future, Ethna. So thank you so much.
Thanks for the opportunity.
That was really great, just to get a bit of a deeper dive into some of the initiatives, and hopefully people found that useful. I'm going to now invite everybody back, all of our speakers, to close out the webinar, just to have a conversation around some of the things that we've been discussing today. So thank you all so much, and really appreciate everyone's inputs, excellent inputs and overviews. I guess now it's a bit of a chance just to maybe reflect on the range of initiatives that we're developing. And I suppose it's really important that we have a variety of supports on offer to people across a whole continuum of need. You know, there's a huge variety of need there. And it's great, I think, that we're looking at developing digital supports, and we know that that's a great way of having great reach, especially for people maybe who don't have the time, or, you know, they're busy with work, with family lives, they might not have the time or ability to come and see people face to face. And at the same time, then it's really important that we have those face to face opportunities as well. Derek, I know there's a lot going on within HSE Mental Health around the development of digital supports, and also more generally kind of the more face-to-face services. Can you tell us a little bit about how you see some of these initiatives fitting within that wider context?
Sure, and an awful lot of it does come back to the whole population and the focus on mental health literacy. So I suppose that's just to say we have a really clear strategy in terms of the type of information that we're communicating to people around, and you know, it's been covered off by Niamh, and we've touched on some of the kind of the key issues that are important at a whole population level. So we'll continue to increase people's understanding of things like anxiety, stress, and so on. But I suppose creating that awareness has to be matched with service provision. So from our perspective, it is about making sure that there's a wide range of support and services available to meet different levels of need. And from that perspective, you know, things like online CBT-based programs have scaled up massively through the likes of Silver Cloud. But beyond that, we can't forget, and one of our sharing the vision recommendations refers to the community mental health services as the cornerstone of our mental health system, or mental health services. So supporting our community mental health teams, I suppose, for children and adolescents, so CAM services, but for adults and for mental health services for older people is really, really important as well. To ensure that the need as it progresses, maybe from primary care or when we're encouraging more help seeking, to ensure that need can be met. We're moving into a period of greater integration across the health services as well, being led by the 6 health regions. And in that context, what we do to support people who might be in acute distress is really, it's a priority issue for us at the moment. So sometimes, we think about the hospital and we think about the community, and maybe that's the way we kind of thought in the past, but what we're working on now is to ensure that there's a crisis response pathway at all points in a person's journey through a significant mental health difficulty. So, distress will present to hospital settings, but we're doing we're investing and doing what we can to increase liaison mental health services, to increase the likes of scans, so suicide crisis assessment nurses, and ensuring that all of these services are integrated back. I've mentioned GPs already, and it is about ensuring that at every part of that service user journey, we're fully resourced across the country, but that each of those parts is integrated. So that's a key focus for us in the short term and a key priority.
Brilliant, Derek. There's a lot happening. You mentioned the word integration. I might come to you next, Niamh. I think the Balancing Stress programme is a lovely example of how you can develop an initiative that can be integrated across a whole range of services and a whole range of community partners. And I know there's been a lot, to try and promote the programme with GPs, with our libraries, with, the GAA. Can you tell us a little bit, Niamh, about how you see balancing stress being integrated across the whole range of communities across the country?
Yeah, and I suppose it started with the integration between health and well-being and psychology services. So it's just interesting that we're mirroring that integration that we're looking for across the HSC and our external partners. As Derek has said, we're moving to new designs within the HSC, so integration is key to everything we do. So we would see the Balancing Stress programme being utilised by older person service, by disability service, by mental health services, acute services. Recently, our acute colleagues took the brochures and the flyers and put them up in A&E and on different wards, because we know that families become acutely distressed when a loved one is unwell. We know that for the Leaving Cert, it was circulated by Health and Wellbeing to schools, because again, not only the young person, who usually copes better, I must say, than the parents on the stress levels, could benefit from it, and our GPs. So it can be used because it's universal, and because there's something in it for everybody, and it's for anyone and everyone, as I repeatedly keep saying, that we would expect that you can dip in and dip out. Ideally, we'd like you to do the 6 sessions, but if there was one session in particular that was of interest to you, start there and maybe then go to the other sessions. It can be used as part of a step care model. So if we look at our community mental health teams, as Derek has said, or our primary care psychology teams, and our counselling in primary care, all of those services may use it as the first step. So somebody presents, and while they're waiting for something else, this may be useful in that regard, but it can also be used as a targeted approach with a healthcare clinician. Basically, we would see it as being used in any which way. We're also trying to develop a face-to-face program, so that for some people, as I think Ethna had said previously, prefer that one-to-one or that group setting when they're with other people. And then, as Sophie May has said, others like the anonymity of being able to log on to get support. So it's trying to just target as many people in a supportive way. So we're hoping that the online, and then coupled with the ones we can hold in our local communities, which is really the programme, but it's taught in a way in a room where people can sit and discuss and go through each session. So I suppose, you know, everybody on the screen is living and breathing integration, but, you know, as Sophie and Ethna and Derek have said, it's about knowing what's out there. So being able to share, because there's no point in working in silos. And you know, the more that we can reach, our aim as anybody working in a caring profession is to provide as much care as possible and as required. And if we've got a colleague doing something that would be hugely beneficial, then we should share it. So the world is the oyster, certainly for the Irish market. So libraries, GPs, schools, sporting partnerships, because I've spoken before at, you know, heavily involved in sports in my area. Young people can get very stressed, can love sports, but also at very competitive levels can cause a great deal of stress. So, you know, it's taking the program, what works for you, what would be helpful, and making it work for you. But as regards integration, I would hope it can be used as a primary prevention, as part of a step care model, targeted model, and then externally and wide in the HSC as people see fit. Hope that wasn't too long.
No, that was perfect, Niamh. Thank you. And Ethna, I'll come to you next. I think social prescribing is another example of initiative that we can integrate right across our communities, into healthcare services, into communities. And another initiative that is really around promoting positive mental health and wellbeing, preventing mental health difficulties. What role do you think social prescribing plays in that continuum? Because I think you spoke earlier around that actually there's a whole range of need that social prescribing can meet, right from primary prevention, people coming in to you, 19 years of age, to maybe people who've had some intensive treatment services. So just really interested in any reflections you have on the role of social prescribing in that continuum.
Yeah, I think social prescribing has a huge role in the preventative space, I gotta say. And even just broader than social prescribing, just the community groups that are out there do a massive preventative job, just the really ordinary, the crochet, the cards, the bridge, just the really ordinary things that are out there, huge role in preventative. And I also think that if somebody is beginning to feel low and avail of the social prescribing service, hopefully it might well help it not to escalate into something more serious or maybe into relapsing. And I think it just gives people like tools and connections so that they're not going to reach that crisis point, I suppose. I think there's huge need for integration, as Niamh said, a huge need. We want to know what's going on and we want everybody else to know what our service is. And I suppose to do that, it would be great to have stronger links, I suppose. Things like shared training and feedback loops and shared meetings, network meetings, all that kind of thing, to integrate between the health systems and also the community systems so that everybody knows what's going on and what the resources are.
Brilliant. Thank you, Ethna. And coming to you, Sophie May, next. Thanks so much for giving us the insight into the Navigator tool. And I know now you're working as an assistant psychologist, and we'd just love to hear from you, just what are your hopes into the future? What would you like to see with the development of mental health supports and initiatives like this to support mental health and wellbeing?
Yeah, of course. It's kind of simple, really, that, like, say, even if you take Navigator, the short-term goals, are to be able to signpost people to mental health supports. But the long-term goals, and I think for all these initiatives that we're creating, is to increase mental health literacy and also destigmatize seeking mental health support. I think it's easy from our standpoint, coming from a psychology background or a mental health background or somewhere else in the sector, to assume that people come out of the womb with mental health literacy and understand terms and know how to help themselves or know where to go for support, but that's not the case. And so these kind of initiatives are the first thing to kind of making that information accessible, making it reliable, and giving people the tools they need for their own agency and their own care. And so it's great to see, and that's kind of where I hope things go, really normalizing these initiatives and looking after your own mental health.
Great. Thank you so much. And thank you all so much for all of your contributions today. I'm going to hand you over now to Derek, who's going to close us out. Thank you.
Thanks, Aisling, and thanks to all our panelists, but also to all of our audience. I think before we leave, there are a couple of closing slides, if we can share them on the screen. And these are really, I suppose, just to highlight the the initiatives, the service improvements, the resources that we've touched on or talked about throughout the past hour. So they include Navigator, which we've talked about in detail, the supports targeted at men, which was launched in mid-September, so through yourmentalhealth.ie/men. The detail of those supports is available, and the Let's Talk About Suicide program is key as well. I think we had a question come in just as to whether the information on these resources would be shared, and they will be shared on LinkedIn. So do stay in touch with ourselves in the Sharing the Vision team through LinkedIn, but also in terms of more information on balancing stress, the social prescribing program, and Minding Your Wellbeing. Again, link in with our colleagues on health and wellbeing at doccommunications@hc.ie or the health and wellbeing profile on LinkedIn. So thanks very much, and do mind your mental health, but more importantly, I suppose the key message is to look out for the people in your life, the people around you. Okay, take care. Thanks everyone.